I hope you're doing fine. I am JEMIENAFTALY, and this channel is called the Pediatric World. I welcome you to my YouTube channel, and this is all about the common illnesses that affect our children. We discuss, we talk to mothers, to the caregivers, to the guardians, and to everybody on the common illnesses that children get while growing up. And we try to talk in a language that everybody is able to understand. We want to be as layman as possible here so that everybody is able to understand. If you are new here, I welcome you to this channel. So today's topic is on the continuation of what we had last time on the preterm births. Today we are going to see now the treatment, the management, and later we are going to see the complications that these preterm babies get. So treatment and management of the preterm babies. So to start by, let me say that this care is given to these babies in NICU. NICU is the neonatal intensive care unit. It is where this care to these premature babies is given. So the NICU, the neonatal intensive care unit. So we do the supportive care first, and the supportive care include, number one is the incubator placement. So remember, these babies are prone into getting low temperatures, and this we call hypothermia. And hypothermia is going to be very dangerous to these babies. So we want to ensure that they have the warmth, they are provided with warmth. That's why we place, in those rooms, we place the incubators and also the heaters. So that is supportive care. Number two care is KMC. We mentioned it somewhere, kangaroo mother care. And this involves skin-to-skin contact. The mother's skin and that of the baby should be into contact. The baby is put inside the mother's body, and there they are able also to get the warmth, and this is again supportive care of these babies. Another thing we do in supportive care is monitoring the vital signs. What are the vital signs? We have the temperatures. We want to keep monitoring these temperatures. Remember, they are prone into hypothermia, into low temperatures. So we want to keep checking the temperatures. Another vital signs is the heart rate. We want to ensure that the heart is beating at the rate that it should, because these babies' heart, lungs, the liver they are so immature. So you want to keep monitoring this heart rate. Another vital sign is the respiratory rate. We mentioned, and also we are going to see that these babies get difficulties in breathing. So we want to keep checking the respiratory rate, that their rate is okay, it is normal. So monitoring the vital signs. Another supportive care we give is feeding. Feeding is supportive care, feeding the preterm babies. And how do we feed these babies? Remember, we said they lack a sucking and also the swallowing reflexes. But anyhow, we need to feed these babies. And how do we do it? We normally put a nasogastric tube. This is a tube that is put to the nose, through the mouth, and reaches the stomach. So we want to feed through here. And what do we feed on? We use again the breast milk. Remember, breast milk is the standard milk when you are talking about breastfeeding. It is the ideal diet for all the babies, despite being preterm. So we put this breast milk into a syringe, and we measure this amount that we start with. We go monitoring and ensuring that the babies are able to get enough, and every day we keep adding some more milk and to what the baby is able to tolerate. So we feed through the NG tube, and we feed again on the breast milk. So we ask the mothers to express the milk, because we are saying these babies are not able to breastfeed on their own. Another thing we do, another supportive care we do blood transfusion. These prematures, they are small babies. They are prone into anemia. Anemia is when the blood levels are so down, and these babies are prone to them. So If the HB is the amount of blood in the body, if it is 4 and below, we want to transfuse these babies. So blood transfusion is a supportive care of prematures. They are also at high risk of getting jaundice. Remember, we had an episode on neonatal jaundice, and we said jaundice is the yellowness of the eyes, the bodies. So we want to put these babies on phototherapy. So phototherapy is a supportive care of these prematures. What are those who are supportive care? What is the definitive care, the definitive management? When you mean definitive, now here we are using now the drugs. And what drugs do we use while in these preterm babies? So number one, very important, we call it surfactant. Surfactant is the one that helps the lungs to mature up and to expand. And because these babies didn't get enough time to get there, they came early, so there was no surfactant for them. So we want to give this to help expand the lungs and to ensure there is functioning of the lungs and the hearts. So we give surfactant. Other drugs we give are antibiotics. Why? Because again, these preterm babies are prone to infections. They get infections so easily. Remember, their immune system is low. They are immune compromised, meaning their immune system is low. So we give these babies antibiotics. Other drugs we give are called diuretics. And this is to try and remove the water from their bodies, because we are avoiding the water to we want to remove the water from the body. So because remember, we are saying the kidneys, the lungs, and also the heart are immature. So we don't want the fluid to accumulate into the lungs, giving us problems. So we give diuretics. Now those are we have seen the supportive care and also the definitive care using the drugs. Now we go to complications. What complications do these preterm babies get? So we have short-term complications and also long-term complications. What are the short-term complications? And before we go to complications, it's good to mention that the earlier the birth, the more it is dangerous. Like if the baby came at 28 weeks and below, so if the baby came at 28 weeks, another one at 32 weeks, this one that came earlier at 28 weeks or below, the complications are more worse. The complications are more worse. And also the low birth weight increases the risk of prematures. So remember, we said prematurity was one cause of the low birth weight babies. So what are the short-term complications? So number one, we have difficulty breathing, and this we are saying is due to lack of surfactant, leading to something we call respiratory distress syndrome. So remember, that's why we are giving surfactant. We want the lungs to expand, so they get breathing difficulties. They get apneic attacks. Apneic attacks is that these babies somehow forget to breathe. They breathe, and all of a sudden they pause, and the pause is prolonged, and then it's like they remember they're supposed to breathe and they start breathing. So they have difficulty breathing. So that is one of the short-term complications. They have heart problems as a short-term complications again. Again, we are saying that their heart is immature, so they are prone to having the diseases of the heart, the congenital heart diseases, and these are things like PDA. This is a holes, you hear holes in the heart. So these preterm babies are prone to that. They also get hemorrhages. They get bleeding from different parts of their body, again because of being premature. And also they have temperature controlling problems. We have temperature instability. They can have hypothermia or hyperthermia. The temperatures can become so high or become so down. Remember, that's why we said we need to keep monitoring these vital signs, and the temperature is one of the vital signs. So the GIT, the gut, again, is not well mature. So it becomes inflamed and they get diseases of the guts. They also get jaundice. We said that. The yellowness of the eyes and also the whole body. And these babies again are prone into having low blood sugar levels. This we call hypoglycemia. And hypoglycemia is a killer. It's a killer to these small babies. So we need to keep ensuring that the blood sugar levels are within normal. They get prone to this hypoglycemia. And we ensure this by feeding, like you have said, the way we feed them through NG tube. So hypoglycemia. They also have low immunity. Remember we said that they are prone to infections. So how about now the long-term complications? Those were short-term complications of the preterm babies. How about the long-term complications? So number one, we have they have impaired cognitive skills. They have delayed developmental milestones. Remember we talked about the milestones. So they also have visual problems, again because they are prone into hemorrhage and it can affect the retina. So we also have dental problems. Those are long-term complications. They have rickets. They are prone into getting rickets again. So these are some of the long-term complications. And the major one is CP, the cerebral palsy. They are prone into getting cerebral palsy, and this we say it is permanent. Cerebral palsy is when now there is brain damage, so it is permanent. This is not reversible later in life, so you can see how serious these complications are. So the cerebral palsy is a long-term complications, and we are saying it is permanent. How do we prevent these complications? We do progesterone supplements. Remember we said hormonal changes, hormonal imbalances were cause of these preterm births. So we want to supplement, we want to give the progesterone. These are hormones to the women during pregnancy and at birth. We also have we suture the cervix. We remember we said another cause of preterm birth is cervical incompetence, the cervix not able to hold the baby to term. So what we do, we put a stitch called the McDonald stitch, and when the mother is about to deliver, she goes again and the stitch is normally removed. So you want to hold this cervix so that the cervix is able to hold until term. So the McDonald stitch is removed again when the mother is almost to give birth. We also have other way to prevent is by having healthy diet. Remember nutrition we said is key during pregnancy. So moms are advised to have healthy diet during pregnancy. We also do calcium supplements. This is to reduce the probability of getting hypertension during pregnancy, because this is very dangerous, and when the mother has high BPs during pregnancy, it is very risky, and what is opted for is to remove this baby before they reach term, because we want to save the life of the mother, and eventually the baby comes out as an preterm birth. So what we do, we give calcium supplement to prevent this. It is called preeclampsia. This is when the blood pressure goes very high during pregnancy, and we are saying it is very, very dangerous. So this is it for today. Now you know, we started by saying about the low birth weight, the preterm birth. Now we have seen how to treat, how to manage, how to prevent, and also we have seen the complications that these babies get. You can see it is very, very serious. So this is it for today. Thank you for staying with me. If you haven't subscribed yet, please hit on that subscription button. Subscribe, like, and share. Also leave a comment down on the comment section, and also hit that notification bell so that you are able to know whenever I post a new video. Thank you very much. Till next time. Bye.